Welcome to this session. We are not present for about half of our lives. You're in the room, but our minds are everywhere. So I want to invite you to be in the room with us. And as Shelley mentioned, we'll just want to start with a presence exercise. So breathe, maybe put your feet flat on the floor. Breath is so important to us. And breath and presence. Take a deep breath in. Welcome yourself into the room. Take a deep breath in. Be present with yourself, with those around us. And with the next breath, if you can, just open your arms. And this is a Qigong. We'll do a very brief Qigong move, exercise, motion, and just receive. And as you receive, use your abdominal muscles to keep your arms out, as opposed to your shoulders and your arms. And just receive the love, the health, the warmth that's all around us. And take a deep breath in, and with the exhale, bring your arms up and almost cradle yourself. And very gently bring your arms down so that they show up as an upside down V over your heart area. And this is called unraveling the heart. So much we carry in our heart and in our souls. Unravel. Leave behind what no longer serves you. Treasure what remains with you. And just gently experience a couple of breaths. Feel the peace that it has entered you. Very gently bring your hands into the prayer position. Thank you for joining today. Thank you. So now that we're all present, I'm a medical oncologist, and part of the reason that I'm so keen on integrative oncology is because I'm very committed to healing body, but I know that the body is connected to the heart, is connected to the spirit, is connected to the soul, and is connected to the people that are around that individual. So when I was a medical student, I walked on fire, and I figured there is something to this mind-body connection, and I really wanted to study it and to bring it to my patients. So that's a little bit about what brought me here, and I wanted to just ask maybe a couple people if they might reflect, maybe take a deep breath to connect with their answer. What brought you here? And just very spontaneous. Anybody that would like to just say a word or two? Anyone? Reconnect. Thank you.
Passion.
What's that? Passion. Great. So really important for us to be connected to our purpose, to what brings us here today. I'm going to come a little bit closer so I can see the slides better. So we're going to try to define integrative oncology, discuss the benefits of integrative oncology, and outline how integrative principles can really make a difference when we're talking about allopathic care. And I'll use the term integrative medicine, integrative oncology. It's not complementary. It's not alternative. So let's think about that. And this has actually been defined in the literature. So I think the slides are available to you, so feel free to look at the article. Patient-centered, evidence-informed, bringing together mind-body practices, natural products, lifestyle modification from different traditions, not limited to Western medicine, alongside conventional, so not instead of, but with. The goals to optimize health, quality of life, clinical outcomes across the cancer care continuum. So not just metastatic disease, not just on treatment, but throughout. There's risk reduction, there's palliation. And an area that I think is so important, and I believe would be very important to all of you, is it really encourages the active participation of the patient. This is not an us and them, like the physician separated from the patient. This is a together. So to really break that up, patient-centered, evidence-informed. That's really what all of medicine should be, right? The patient at the center, and we're using the best evidence. Mind-body practices, so really these can be, one could think of them as different systems, different approaches to health and healing, but all of this for the benefit of the health of the patient. So integration is incredibly important. And when we want people to be better, it's not just the outcome like you're cured. Because patients, and again, I've learned so much from patients, from survivors telling me, that ain't enough. I want to live well. And that's so important. And again, this concept of across the cancer care continuum. A lot of these approaches are going to decrease cancer incidence. And ultimately, that's the goal. I feel like every time I see a patient that had a screenable malignancy, that's a failure of the health system. We didn't do enough. And the concept of empowering people so that they can be active in their own process for all the way from risk reduction to palliation. And again, I love the words before, during, and beyond. Not just after, right? We're not just looking to after cancer. It's beyond. Now, how come? Like, why does this work? And there's a ton of science around this. And we understand hormones. Hormones are critical to our functioning. And stress. How many of you have felt stress today? Like really, I think everybody, right? Let's be honest. Our bodies, again, it's just a natural process. We get stimulated, we react, we have stress. But so much in our lives, it's chronic. And that impacts, and that can impair, and that can wear our bodies down. That can make us more vulnerable to a lot of chronic illnesses. And what integrative medicine does, it helps turn that down. So creating an environment which is going to be less hospitable for those cancer cells. So scientifically based, and a lot more that we can say around that. Other elements of evidence, the initial guidelines around clinical practice came in 2007. So a young field in some ways, a young field trying to marry allopathic medicine, but an ancient field because these healing practices have been there forever. So you see some of the guidelines. And most recently, we'll be having the pain guidelines published and pending fatigue, anxiety, depression. So guidelines in partnership with the American Society of Clinical Oncology, some of these. So again, this is not voodoo medicine. This is really mainstream medicine approaches, integrated. Something that I read recently, started to read, haven't finished, Do You Believe in Magic by Paul Offit, because there are detractors out there, right? There are people that are saying, that is voodoo medicine. What are you saying? And one of the areas in the book, an outspoken advocate for science-based health advocacy who is not afraid to take on media celebrities, talking about integrative medicine, who promote alternative practices, Dr. Offit advises, there's no such thing as alternative medicine. There's only medicine that works and medicine that doesn't. And I want to write a note and say, we agree. That's actually, we are on the same page. We're not talking about alternative. We're not talking about complementary. We're talking about evidence-based. And if we go back to the definition, lifestyle medicine, so important how we lead our lives, what we put into our bodies, not just from the sense of what we eat, but from the sense of what's around us, what we see, what we touch, and why shouldn't all of that contribute to our health? Mind, body, and we know we didn't talk, we could talk for so much longer, how people feel after a mind-body experience, like what exercise, like what we just did. I would venture to say 100% or pretty close to 100%, people feel better. You can't argue with feeling better. And then the bringing in of other systems of healing and thinking about rigorous evaluation in all of these areas. So I think we're on that same page, right? Integrative medicine is medicine that works. And that's our goal. But with this, there's a lot to learn. There's a lot to learn about how to integrate implementation science, how to prescribe. So I work with patients, like how do you prescribe a mind-body approach? You know, how many minutes a day? We did a study in breast cancer patients, and the standard dose for meditation is 30 minutes a day. We found impact 5 minutes. 5 minutes that there was a difference. I encourage you to find 5 minutes to prioritize your health. We want to know what are biological outcomes, because there can be improvements in quality of life, but how is that linked as well to biological outcomes? We want to know where the knowledge is and where the gaps are. But really importantly, are there other ways of knowing? We have the scientific method, we have the randomized double-blind cancer clinical trial. Is that the only avenue? What are other avenues? And how do we really gain that understanding? So a lot of questions, a lot for us to learn. I'm just sharing with you that in my couple of years that I was at, 3 years that I was at Huntsman, pretty much that's all I did was integrative oncology. Here in my current role, I do some, but I am very, very struck by the fact that every patient leaves feeling better. So again, I feel like you can't argue with the patient's own experience. And the other metrics, quality of life, side effects, improved immune response, biological correlates, and all of this helps the patient, the person, to see the opportunities for growth. So people can transform. I think it's transformative to the experience. In general, we have done science in kind of this linear mechanistic way. Ours is we're proposing an interconnected way. To me, just the sound of it is better. An interconnected way. Some people ask, so for example, we did this other study which was it was physical activity, group-based, individual-based, and people said, well, how do you know it's the group or the physical activity? Do I need to know that? If people are better, it's what works for the person. So maybe, again, shake us out of our linear thinking to interconnected thinking. So I leave you with really what my sense is of medicine, what my sense is of the world, and what I've experienced even just coming and being with you today. The whole world is a series of miracles. Thank you for the opportunity to speak with you today.